everyone. My name is Tiffany Babcock, and I am a clinical pharmacist at Geisinger CCPS, which stands for Centralized Clinical Pharmacy Services. A little bit about myself is that I went to Wilkes University and graduated in 2015. Normally, pharmacy school is 6 years, but I was actually able to graduate in 5 years due to taking advantage of a dual enrollment my high school had with a local college. So by taking some AP classes and a couple summer classes, I was able to eliminate a whole year of undergrad classes. So after graduating, I worked in retail where I interned since I was 18. I was quickly promoted to pharmacy manager, and I spent a few years there. I then had the opportunity to work at a medical marijuana dispensary, which was one of the first dispensaries to open in Pennsylvania. So after spending some time there, I was fortunate enough to find the career that I have now at Geisinger. So I was inspired by my two older sisters to become a pharmacist. They went to Wilkes as well for pharmacy school. I knew I always wanted to be in the medical field. And since working in retail up front since I was 16, I was always intrigued by the pharmacy department. I was able to see the pharmacists interacting with patients daily and just really how accessible they were to the community for medical advice. So at my department, we have a collaborative agreement with the family practice physicians and a number of specialty areas such as neurology, rheumatology, anti-coag, gastro, etc. So really what this means is that we have the ability as pharmacists to authorize refills. We can order lab work for patients to safely monitor their therapies, and we can also make clinical suggestions to the providers regarding patients. So for example, we do a bunch of renal dose adjustments. We add statins for diabetic patients. We add medications or maximize current therapies if patients are not at their goals. We suggest non-pharmacological therapies to reduce cholesterol. We do prior auths, we address adherence barriers, etc. The list goes on and on. That's just a few examples. So my favorite part about my job is that I love communicating with all members of the healthcare team on a daily basis. I'm frequently talking with co-pharmacists, technicians, nurses, physicians, phlebotomists, front staff members on a daily basis. The impact that we can have for patients is truly tremendous just by working together, being a team player, and communicating well. Also, a perk about my job is working from home. So my advice for someone going to pursue pharmacy is really to just explore all the different avenues out there and shadow as many different areas of pharmacy as you can. So honestly, when I went to school, I really only knew about retail pharmacy. I didn't realize the extent and the different avenues that there were. I had mentioned previously that both of my sisters are pharmacists. Well, my one sister went back to law school and now practices healthcare law, and my other sister has her MBA in public health degree and works at a big pharmaceutical company as a director in marketing. So there's many different paths to pharmacy. Just continue to explore and don't settle until you find the area of pharmacy that you love doing. Believe me, it's out there. You just have to find it.